I'll show you the image for each case, so pay close attention to the findings and try to answer before I reveal the correct option. Starting with the first case. A 3-year-old horse is presented for evaluation of a dry, horny, wart-like mass on the distal forelimb, as shown in this image. You can clearly see these rough, raised lesions. On further examination, smaller wart-like lesions are also present on the muzzle. The owner mentions that other young horses in the herd have developed similar lesions. Now, what is the most likely diagnosis? Option A, trombiculosis. Option B, melanomatosis. Option C, dermatophilosis. Option D, pediculosis. Option E, papillomatosis. Take a moment and look carefully at the lesions shown in the image. The correct answer is option E, papillomatosis. These are warts, or papillomas, caused by equine papilloma virus. As you can see in the image, these lesions are dry, rough, and wart-like. This condition is most common in young horses and commonly affects the muzzle, distal limbs, inner pinna, and genitalia. It is contagious, which explains why multiple horses in the herd are affected, and most cases resolve spontaneously. Now ruling out the other options. Trombiculosis is caused by mites and typically results in pruritic dermatitis, not wart-like growths. Melanomatosis presents as dark pigmented tumors, especially in gray horses, not these rough lesions. Dermatophilosis causes crusty, paintbrush-like lesions. And pediculosis leads to itching and hair loss due to lice infestation, not discrete warts. Now moving to the second case. This calf is presented with neurological signs including ataxia, intention tremors, and hypermetria, and importantly, all signs have been present since birth. In the image shown here, you can compare a normal calf brain with the affected one. Notice the underdeveloped cerebellum in this calf. What is the most likely cause of this condition? Option A, organophosphate toxicity. Option B, border disease. Option C, bovine viral diarrhea virus. Option D, copper deficiency. Option E, caudal occipital malformation syndrome. Pause here and focus on the congenital presentation and the image. The correct answer is option C, bovine viral diarrhea virus. In utero infection with bovine viral diarrhea virus is a common cause of cerebellar hypoplasia in calves, which is exactly what is shown here. This explains the neurological signs present since birth. Now ruling out the other options. Organophosphate toxicity causes acute cholinergic signs, not congenital defects. Border disease primarily affects sheep, not cattle. Copper deficiency can cause neurological signs, but not the classic cerebellar hypoplasia seen here. Caudal occipital malformation syndrome is seen in dogs, especially Cavalier King Charles Spaniels, not in calves. Now the third case. A poultry farm has been experiencing increased illness and deaths over the past few months. Some birds showed torticollis before death. In currently sick birds, you can see swelling of joints, wattles, and foot pads, as shown in this image. On necropsy, there is caseous, suppurative material inside the wattle and necrotic lesions in the lungs. Which agent is most likely responsible? Option A, fowl pox. Option B, Pasteurella multocida. Option C, Marx disease virus. Option D, Salmonella gallinarum. Option E, paramyxovirus. Take a moment and correlate the lesions with the image. The correct answer is option B, Pasteurella multocida. This is a classic presentation of chronic fowl cholera. As shown in the image, the swollen wattles filled with caseous material are highly characteristic. Chronic infections show localized lesions, while acute cases may cause sudden death. Now ruling out the other options, foulpox causes nodular lesions on skin and diphtheritic lesions in the mouth, not caseous wattles. Marx disease causes nerve enlargement and tumors. Salmonella gallinarum leads to septicemia but not these localized caseous lesions. Paramyxovirus, like Newcastle disease, mainly causes respiratory and neurological signs without these specific findings. Now the fourth case. A middle-aged spayed female dachshund presents with polydipsia and polyuria. She is otherwise alert and afebrile. On examination, as shown in this image, there is a distended pot-bellied abdomen, thin skin, and alopecia. What is the most likely diagnosis? Option A, hepatic insufficiency. Option B, stump pyometra. Option C, hyperadrenocorticism. Option D, urinary tract infection. Option E, hydronephrosis. Pause and connect the signs with the image. The correct answer is option C, hyperadrenocorticism. Also known as Cushing's disease, this condition presents with classic signs such as potbelly appearance, polyuria, polydipsia, thin skin, and alopecia, all clearly visible here. Now ruling out the other options. Hepatic insufficiency may cause systemic illness but not these classic skin changes. Stump pyometra can cause polydipsia and polyuria, but the animal is usually ill and does not show skin atrophy. Urinary tract infection causes urinary signs but not abdominal distension or alopecia. Hydronephrosis affects kidneys but does not produce these systemic and dermatological signs. Now the final case. A 9-year-old neutered male cat is presented with progressive weight loss. He is an indoor-outdoor cat and has become less active. He now wheezes when moving. Over the past few weeks, he has had decreased appetite and frequent vomiting. On examination, there are inspiratory wheezes and muffled, irregular heart sounds. Vital parameters show a temperature of 103.1 degrees Fahrenheit, heart rate of 124 beats per minute, and a respiratory rate of 30 breaths per minute. As shown in this radiograph, you can see abnormal structures within the thoracic cavity. What is the most likely cause of this illness? Option A, lung lobe torsion. Option B, hypertrophic cardiomyopathy. Option C, pleural effusion. Option D, hit by a car. Option E, feline mediastinal lymphosarcoma. Take a moment and carefully examine the radiograph. The correct answer is option D, hit by a car. This is a diaphragmatic hernia. In the image, you can see gas-filled loops of bowel inside the thoracic cavity, overlapping the lung fields. This should never happen under normal conditions and indicates rupture of the diaphragm. This condition is most commonly caused by trauma, especially road traffic accidents. Even without a clear history, animals can present later with chronic respiratory and gastrointestinal signs. Now ruling out the other options. Lung lobe torsion, presents with acute respiratory distress but no bowel loops in the chest. Hypertrophic cardiomyopathy causes cardiac enlargement, sometimes a valentine-shaped heart, but not intestinal structures in the thorax. Pleural effusion leads to fluid accumulation and floating lungs, not gas-filled bowel loops. Feline mediastinal lymphosarcoma causes soft tissue masses, not gas densities. Only a true veterinarian can answer this. The patellar reflex tests the integrity of which nerve? Option A, femoral. Option B, sciatic. Option C, tibial. Option D, peroneal. Option E, sural. Drop your answer in the comment box. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update from Vetcare.